It keeps happening. Can you unmute me, and I'm going to let them know that it's going to be a minute. Hello to those remotely connected. We will be starting the meeting in a minute. We are just waiting for a quorum, so a minute or two. Thank you.
For being late, I'm going to go ahead and call the meeting to order. Will the secretary please call the roll?
Director Deere?
Deere is here.
Director Harrington?
Present.
Director Robinson?
Present.
Chair Ryder?
Here.
And for the record, those directors also present. Director Curry?
Present.
And Chair Taylor?
Present.
You have a quorum.
Thank you. Do you have someone?
Deere.
Is there a motion to allow Director Deere to remotely participate in the meeting as a voting member? So moved. Motion's been made. Second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Ayes have it. All right, public testimony.
We did not receive any registrations, nor did we receive any written.
Is there anyone here for public testimony? I don't think so. All right, we're going to move right along. Finance Committee meeting minutes of April 19, 2024. These were approved by the board at the April meeting, but are being presented for the committee's review and discussion as necessary. Are there any corrections that need to be made to the minutes? Any corrections to the minutes? Any corrections to the minutes? Any corrections to the minutes? Hearing none. Is there a motion to accept the minutes? So moved. Motion's been made. Is there a second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Proposed real estate matter. Dr. Hasbrook. All right. There is a proposed real estate matter requesting approval to enter into a lease for use of approximately 15,850 square feet of warehouse space in a building located at 2101 to 2171 West 22nd Street, Cermak Road, Broadview, Illinois. The space will be utilized by the Cook County Department of Public Health for a vaccine distribution center for the purpose of providing a safe storage of necessary supplies and vaccines that can be easily distributed throughout the county as needs arise. Dr. Hasbrook, do you have anything to add? You want to?
Well, no, I think just to summarize it, it will serve as both our vaccine redistribution center as well as kind of a warehouse for medical countermeasures, PPE, things like that. We are responsible for receiving these such commodities, countermeasures, et cetera, from the state. We hold them and then we distribute them to the other, throughout suburban Cook County. So the current facility is being demolished over at Oak Forest, and so this is to get us ready so that we're poised to respond to any other preparedness matters.
So this essentially replaces Oak Forest?
Yes, it does.
All right. And do you feel like we're adequately stocked with PPE?
At this point in time, probably not, but we do have a contract in process to get the stuff that we need.
Okay. All right, which would be a separate matter anyway. Is there a motion? Is there any questions for Dr. Hasbrook? All right, hearing none. Is there a motion to approve item 3B, the proposed request to enter into a lease agreement for use of approximately 15,850 square feet of warehouse space in a building located at 2101 to 2171 West 22nd Street, in Broadview.
So moved.
Motion's been made. Is there a second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Ayes have it. All right. Thank you. Thank you, Dr. Hasbrook. Though you were going to be, Charles is going to join you.
Yes.
You're up first.
Tight.
Next, we're going to go to, yeah, I know, Charles, I noticed that. I noticed that. It would bother me, too.
I don't know if I was gonna be that petty about it.
Yeah, but you still had to say something, didn't you? Items under the Chief Procurement Officer, we have, 39 contracts and procurement items, and, Charles, Jones, our Chief Procurement Officer. Charles, do you have anything to say before we start going through the items?
Yes, just a little housekeeping. Good afternoon, Charles Jones, Chief Procurement Officer. 39 items, of which 34 require letters, responsive from the Office of Contract Compliance. We have 18 back and 16 are in process. So with that being said, response.
All right, so the first, items 1 and 2 are being presented by Dr. Hasbrook, the Cook County Department of Public Health Chief Operating Officer. Dr. Hasbrook, take it away.
Okay, thank you. So two really quickly. The first one is to execute a contract that is grant funded. The vendor is Roosevelt University. Has a fiscal impact of $450,000. Again, this is grant funded, ARPA funded in this case. They will be doing, conducting evaluation for us for our Cook County Good Food Purchasing Program, which we presented to this body previously. So they're going to really evaluate the impact of this program across the food system. Happy to take any questions. All right. If not, move on to execute another contract. Again, grant funded. Again, ARPA funded. Fiscal impact of $422,000. The vendor here is Human Impact Partners. They're going to be partnering with us to really help us to implement a strategy to engage the community in a more deeper way. So they're going to be doing some trainings and technical assistance to help us improve community engagement and partnership with something referred to as community power building organizations. These are really kind of key organizations throughout our jurisdiction that really kind of activate social cohesion and various different movements, if you will, in the community. In this case, really to get them more engaged with health and the services that we offer. So they're going to be helping us do that, and there's a number of things that they'll be doing with us in terms of doing a scan, in terms of creating a blueprint and evaluating that blueprint, and again, deepening our community engagement partnerships going forward.
All right. Any questions for Dr. Hasbrook on those items? Thank you. Thank you. Next up, items 3 through 5 are being, health plan services are being presented by Aaron Galiner, our Chief Administrative Officer for Health Plan Services.
Good afternoon. The first item before you is, and all three items that I'm going to be presenting are exercising one-year renewal options. The first is a one-year extension with Access Community Health Network. This is for delegated care management services they perform on the health plan's behalf for patients that are impaneled to their primary care physician sites. The next item is for third-party administrative services, also a one-year renewal option. This is for Evolent Health for a product we have called Cook Medical Group, which is delegated services we provide under an agreement with Blue Cross. This is separate from our county care line of business. This is a $1.7 million one-year renewal option. And then my final item is for Press Ganey for $420,000. This is also a one-year renewal, and this is for required surveys that are sent out, both for member experience surveys for the health plan that the state requires us to do, called our CAP surveys, as well as we also do appointment availability monitoring using Press Ganey that calls out to our provider network. that, I'm happy to answer any questions.
Any questions for Aaron? Seeing none, we're going to move along to item number 6, behavioral health. Dr. Nutter.
Good afternoon, Tom Nutter, CCH Chief Behavioral Health Officer. This contract is with HRDI for their Community Triage and Wellness Center. The agency provides alternative services to emergency rooms for those who are in having mental health crisis. We've had a long-standing relationship with HRDI since at least 2018, and that's been paid on a per patient served basis. In the past, it's been in FY 20, 21, 22, and 23, just under $800,000 per year. That previous contract expired at the end of November 2023, and through a competitive process, HRDI has been selected, and we'd like to continue this again through at least through the end of this year. There was a gap between 11/30 and present, so there will be a forthcoming request for a payment without contract for HRDI. I'm happy to answer the questions.
Any questions? Hearing none, thank you. Next up are items 7 through 13, clinical, being presented by Dr. Fegan. Claudia? Claudia, I was in such a rush to get in here.
I think you didn't have your Converse on.
I do, my burgundy ones. They replaced my wingtip Allen Edmonds.
We'll let you go this time. Okay, so the first one is for Deploy, which is a surgical implant that we use for ortho trauma procedures. The next one is Stryker. These are craniofacial implants and equipment that we use in performing these facial surgeries. It allows us to treat patients with a variety of different needs. It comes in a lot of different sizes. The next one is a continuation of the anesthesia machines that we use in the OR. There's upgrading the current anesthesia fleet, which I won't get into all the technicalities, but it it allows us to do better with our anesthesia. The next one is with Medtronic. This is products that we use to treat patients who have cancer, chronic pain, and we use intrathecal, which is into the spinal canal, the space where the cord is, and it's also useful for non-cancerous pain. The next one is with the Northwestern Medical Faculty Foundation, and these are for physicians who provide us additional coverage in ENT, otolaryngology, for surgical and clinical services, and in facial plastic reconstructive surgery and laryngology. Gives us additional coverage. We only employ a few otolaryngologists, and because of our trauma coverage, we need to have assistance with evening and night and weekend coverage. The next is another Stryker contract. This is temporomandibular joint replacement instruments that we use for replacement surgery here at Stroger. And the next is cardiac insight. So this this is a patch that we place on the patient, they wear at home, and it gives us a cardiac monitor for 7 days. People may recall the older Holter monitor we used to put on people, but now it's a piece of software that we put on the patient, and they mail it back, and we have a record of their EKG for the 7-day period.
All right. Any
I'm
questions
happy
for,
to answer any questions.
any questions for Dr. Fegan? All right.
Thank you, Claudia. I just got a notification that there is a new Nike drop today, so I will look to see, if I'll show up with something new next month. All right. Request number 14, equity and inclusion, Shannon Andrews.
So Ms. Andrews is running slightly behind because of another conflict. Let's drop down and, she should be here. If not, we'll take it at the end, and if not,
Okay.
I'll do it.
No problem. Request, oh, there it is.
Yeah,
There
look at
she is.
Speaking of
Perfect timing. You're up. Request number 14, equity and inclusion.
Wow, I promise we did not plan or time that. Good afternoon, Shannon Andrews, Chief Equity and Inclusion Officer. The item in front of you today is a request to extend and increase the contract with Busy and Inc. This vendor, which is also our GPO, is providing consulting resources for the implementation of our inventory management system. This request is a bridge until we can enter into a new contract with our GPO vendor for an extension of services or for a continuation of services. As you may know, we are implementing a new technical inventory management system, which is taking us from a very manual process, literally almost an average of pen and paper, to very high technology, bringing us up to speed with other healthcare organizations. But it has not been a small feat. We've done this in partnership not only with our HIS department, but also Building and Grounds. This system will be implemented not just here at Stroger, but also at Provident and throughout the healthcare system. And so this will take us through July of this year. Happy to answer any questions.
I don't have any questions, but it'd be interesting to see what impact this has in terms of cost and time savings.
Absolutely. We can circle back. We're unbelievably excited. This has been a Herculean effort to go through the solicitation process and now the implementation. So we'd be happy to follow up with that. Thank you.
Any other questions? Hearing none. Thank you, Shannon. Moving on to request number 15 through 18. Finance, we're going to hear from Scott Spencer, our Associate Chief Financial Officer.
All right. Good afternoon. So we got four contracts here from Finance, starting with, for Guidehouse, it's an extend and increase request. So Guidehouse provides revenue cycle support to help us meet and exceed our rev cycle KPIs, and in addition to that, leveraging the contract to transition coding, billing, collections to in-house services. So looking to exercise the second one-year renewal option, not to exceed $16.8 million, and it'd be extended through March 31st of 25. Second item, vendor is Salute Revenue Partners. Again, extend and increase the contract. It's a one-year renewal option. Vendor provides follow-up and collection efforts. And it would be not to exceed $5,348,974, and would be extended through August 31st of 2025. The third item from Finance, excuse me, is Experian Health. Extend and increase the contract. This is the application that we use to verify insurance eligibility and find coverage. It would be extending the contract not to exceed $680,235, and would extend the contract through 10/31 of 25. And the last item is Imagine, extend and increase the contract not to exceed $345,108 through February 28th of 2025, and they provide remote cancer registry services in order to keep us compliant in regard to federal and state requirements reporting and also ensure maintenance of Stroder's accreditation with the COC, cancer accreditation. So happy to answer any questions you may have.
Any questions? Hearing none, thank you. We're going to move now to request number 19 and 20 being presented by our interim Chief Human Resources Officer, Carrie Premival.
Good afternoon again. So I have two contracts in front of you. The first one is for extension of Cross Country. They are our RPO vendor who is an add-on to our recruiter workforce to recruit our vacancies. And they have a whole book of business that recruits from sourcing all the way through the decision to hire process. We are going through the RFP process and selecting a vendor imminently, but there will be a time for transition, and we do not want to slow down on filling our vacancies. So this extension should take us through January of 2025. And the request is to not exceed 1.9 million, although the drawdown, once we have the new vendor in place, will begin. And then, of course, we expect that they will siphon off by the end of January.
Any questions?
All right, the next one is for an executive search firm contract extension. We currently work with Kirby and Bates for filling interim leadership roles. And this is to extend their contract through for a 12-month extension in an amount not to exceed $900,000. We are also imminently going to be going through an RFQ process for our additional vendors to do these executive searches that we need to have done to fill our vacancies at the executive level. This particular firm has most recently filled the interim associate chief human resource officer, as well as the associate chief hospital executive for Provident Hospital, and are working on the general counsel positions, the associate general counsel position, as well as compliance positions as well. And that's all I have.
All right. Any other questions? Hearing none, thank you, Carrie. Moving on to request number 21, nursing. Dr. Bina Peters, our chief nursing executive. Good afternoon, Bina.
Good afternoon. I only have one request.
All right.
This request is to purchase the 7 machine to support our dialysis program, which is called the Robert Portable Reverse Osmolarity. So it's one-time purchase, and also this comes with their maintenance plan, which is not to exceed no more than $270,000. Any questions?
Any questions for Dr. Peters? Hearing none, thank you, Bina.
Thank you.
Now we're going to move to request 22 through 31, being presented by Adam Weber, Executive Director of Special Operations.
Thank you. Good afternoon.
Good afternoon.
I will go through request 22 is for Cintas Corporation, request to increase that contract by $864,192. They provide support services, uniforms, cleaning supplies, floor mats, carpet runner rentals, and various EVS supplies throughout the Cook County Health System. Next is corporate cleaning services. Requests to extend this contract by 6 months through November of 2024, no additional fiscal impact. They provide window cleaning services to Core, Provident, and Stroder Hospital. Next up is Amerigus, formerly Maxim, locum tenens and advanced practitioners, extending that contract by 6 months to February of 25, no additional fiscal impact. They provide locum tenens services to CERMAC, anesthesiology, psychiatry, radiology, and our ACHN clinic. Next is Cross Country Healthcare Staffing Services. This is to extend this contract by 6 months through November of 2024. No additional dollars here. Continuing to provide temporary staff for our new and existing positions within CCH. primarily in radiology, respiratory care, support services, medicine, and cardiology. And there is currently an RFP that's in the evaluation process for temporary services across CCH. And I'll reference this on a couple more contracts coming up. Next is Smith Group, amend and extend this contract to March of 25. No additional fiscal impact. We use Smith Group to provide architectural and engineering services through completion for various construction projects across the county. The amendment is for additional services related to design developments required for various Provident projects to continue to expand services and complete other existing projects there. Next is Allied Universal Security Services. This is to increase that contract by $5,032,129 to May of 25. They provide additional temporary security services to Stroger, as well as oversee the security of our ACHN clinics and Providence. And an RFP is currently being developed to take that out for bid for these services. Next is Pickens & Kane Moving and Storage Company. This is to increase that contract by $675,000 through June of 2025. Pickens & Kane provides warehouse handling, inventory, reporting, storage, and delivery of furniture, fixtures, and equipment across our CCH facilities. Next is GSG Consultants. This is to increase that contract by $496,666 through July of 25 and amend services. This is the first of two renewals that we have there. They provide architectural and engineering design services for our existing buildings, tunnels, mechanical, electrical, and plumbing systems at Oak Forest, with exception to the Department of Emergency Management. The amendment will allow for additional design services to preserve, stabilize, and isolate the Oak Forest Catholic Church there. Item 30 is Granger, executing a contract for $15 million through November of 2029. There are two one-year renewals at the end of that contract. Vendor provides institutional supplies to support the facility maintenance and assist with repairs across CCH. Item 31 is Natus Medical, executing a contract for $545,000 to run through June of 2029. Natus provides service and extended warranty on our EEG and EMG equipment for the neurology department, as well as providing backup equipment in case one of those pieces of equipment goes down. Next is Amerigus Maxim Healthcare Services. We're going to extend that contract to November of 2024. No additional fiscal impact. They provide temporary services in our support services and lab areas primarily. Another one where that RFP is in the evaluation process for temporary services across the system. And my last one is Corsair. We're looking to increase that contract by $3.5 million and extend it to November of 2024. They provide temporary staffing in our support services, radiology, and lab areas. And this is the third of those three that is having an RFP conducted to do that evaluation for temporary services across the system. That's all I got.
All right.
Any questions for me?
Any questions for Adam? Hearing
Thank
none, thank you. We're going to now move to request number 34, patient experience and communications.
Good morning, or afternoon. Alice from Convention, Chief Communications and Marketing Officer. This is
Morning,
an
Alice.
amend and increase contract for Press Ganey. This is building on the consumerism and patient experience work that we're doing with the firm. They will be building out a provider finder for our website. Right now, we just have an alphabetical list of our doctors on our website, and through this platform that they'll be creating, patients will be able to search by specialty, by race, ethnicity, by gender, language spoken, and location. So we're really excited to be promoting our providers in this way. And I'm happy to answer any questions.
Any questions for Alex?
Thank you.
Thank you. Request number 35 to 36, Provident, Dr. Arnold Turner.
I don't see him here, so I guess I'll take the next two.
All right.
All right, request 35, we're asking you to extend and increase the contract with Dialysis Care Center Management. This is for hemodialysis outpatient services on the campus. We have a dialysis center there that the vendor will be taking care of. An RFP was advertised and is currently in the evaluation process. This is $1.6 million and a 6-month extension through 12/1/2024. Request 36 is similar, same vendor, however, this is inpatient hemodialysis services at Provident at the ICU and 8 West. We're extending and increasing that contract as well, $600,000 for a 6-month extension to the end of fiscal year, November 30th, 2024. Any questions about these two requests?
Any questions for Charles?
Thank you.
All right, hearing none. We're going to move on to request number 37, Quality.
Good afternoon, Raji Thomas, Interim Chief Quality Officer. The request is to amend and increase the current contract approved on April 31st, 2021 with Proscani Associates to continue the provision of services to conduct patient surveys in the outpatient and inpatient settings in English and Spanish, and also to expand those services to Provident Dialysis Gap Survey. The contract amendment will also cover leadership training in high reliability methodologies for the NDS system. The amended contract is not to exceed $692,128 over the next 3 years and will run through 2026.
All right. Any questions? Hearing none. Request number 38, 39, approaching the table is Donica Austin Cathy, our Chief Hospital Executive at Stroger Hospital. Donica, it's all yours.
Thank you. Good afternoon. Okay, so before us, we have an extended increased contract for Cardinal Health for distribution of laboratory supplies in a fiscal amount not to exceed $1,500,000. The revised contract period of 8/1/2024 through 7/31/2025. The vendor is a prime distributor and key manufacturing partner for laboratory products. We're exercising the second 1-year renewal option. The second one is an execute contract for Biorad Laboratories for reagent kits, rental of 2 testing systems and an analyzer, and the amount not to exceed $601,344. Contract period 6/1/2024 through 5/31/2027. The vendor will provide equipment, maintenance, reagents, controllables for the hemoglobin A1C testing. These systems are used for detecting diabetes by a chemistry laboratory. The instruments will speed up the testing for the lab, allowing for completion of volume with greater efficiency. Any questions?
Any questions?
Thank you.
Hearing none, thank you. Charles, any closing remarks before I entertain a motion?
No.
All right. Is there a motion to approve item 4A, contracts procurement items containing request number 1 through 39, subject to completion of a review by contract compliance?
So moved.
Motion's been made. Is there a second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed?
Aye.
You guys have it. All right. We're going to move along to B, fiscal year 2024, first quarter report of contracts executed under the authority of the CEO, which is under $150,000.
Yes, sir. Thank you. So for the first quarter, with contracts under $150,000, first quarter being December of '24, January and February of 2025. Very small list for you this month. Only 10 contracts. Of those 10 contracts, 6 were for capital equipment purchase as we look to spend down our FY '24 capital equipment purchase. 5 of those 6 contracts were with TPO vendors, and just calling off a couple other ones is over $100,000. We had GE Medical Systems where we bought our CareScapes B150 patient monitors for CERMAC, $114,000. The Lutheran Social Services of Illinois, LSSI, was a grant-funded contract for Families in Its Together program, which is the fifth program there, $148,000. And then, all the way at the bottom there, Q-Centric LLC for the Department of Quality, vendor provided, abstractions for all charts, abstracted core measurements for storage in Providence Hospital, $142,000. Any question about this?
Any questions for any of the contracts under the authority of the CEO?
All right, thank you very much.
John, we have no emergency purchases to report this month.
No, sir.
All right, and then,
Thank you.
Contacts under the, items under the Chief Financial Officer. Thank you, Charles. Charles, we do a metrics next month? Yeah. All right, thank you. Welcome back, Scott. That's
Thank you.
Receive and file items, huh?
Yes, sir. All right, we'll start, so we've got, four items here. We've got, two awards, $258,000, just over $258,000. And then, two increases for $3,385,927. See, the $3 million is a carryover, associated with, the Department of Health and Human Services and the CDC. And then we've got the other three are associated with Rush, and again, are just, two of the three are, new awards, and then $57,000 increase. So any questions on that? Okay. All right, hearing none, we've got, moving to this month's transfer, we have requesting a...
So first, let's do a motion to receive and file item 5A, the grant award related items.
So moved.
Motion's been made. Second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Sorry about that. We'll do the transfer of funds now.
Yep. So requesting a transfer of $10.3 million from surplus salaries and wages, and transferring those funds to $2.8 million to communication services to cover purchase of laptops, $5 million transferred to institutional supplies to cover cleaning for Stroger Hospital and Providence Hospital, and $2 million being transferred to ambulance services to cover those ambulance services for new arrivals.
Any questions on these items? Hearing none, is there a motion to receive and file item 5B, the transfer of funds?
So moved.
Motion's been made. Is there a second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed?
Aye.
Ayes have it. All right. The financial update.
Yes, all right, so for the 4 months through March 31st, on an accrual basis, we're just under $111 million favorable variance to budget. On a cash basis, we're $33 million favorable. So the drivers there, net patient service revenue, or NPS, are favorable to budget due to higher than budgeted volumes and revenues, and also favorable on the capitation side of things with higher than budgeted county care membership. On the expense side, we are unfavorable in regards to county care claims, again, due to the higher than budgeted membership. County care is coming in $2 million favorable variance to budget, with membership just over 441,000, roughly 20% greater than budget. So next slide, please. So taking a peek at our income statement here, just want to draw attention to, again, the net patient service revenue. of, 45 million favorable to budget, as well as the county care, capitation being favorable to budgets of 156 million. And then dropping down to our expenses, salaries and benefits and overtime being favorable to budget, due to, some open positions. On the purchase service line, we're 62 million favorable to budget. We are seeing, some, improvement in spend on the contract labor side. Medical claims expense, unfavorable, just under 164 million, again, due to the same better than budgeted, county care membership. So again, just to, bring your attention to, the net income of 108 million, we budgeted, effectively zero, through this point in the year, so favorable by just under $111 million. So on the next slide, starting with Stroger, average daily census of 322, better than budget of 287 and prior year of 294. At Provident, average daily census of 22, effectively at target. ER visits at Stroger, 11% higher than budget. Provident, just short of budget, less than, but that equates to less than 1 per day. In terms of surgeries, Stroger 5% behind budget, and Provident behind budget by 117, or about 1 per day. On the CCH side of things, we are 454 behind budget, and on the primary care side, and specialty care effectively at budget, 68 better than budget at this point. And again, county care membership, about 13% or 49,000 members better than budget. So next slide. Oh, thank you. So just wanted to draw attention to on the far right side of each of these graphs, our 2024 year-to-date actual or projected totals for the year, very much in line with where they've been over the past few years. And also in the top left-hand corner, we can see our outpatient clinic visits, our overall positive trajectory, heading in the right direction. Year-to-date payer mix. So Medicaid at 58.6%, and uncompensated at 16.2%. We did see a slight uptick in the uncompensated care of 0.02% this month, which is redetermination is in full swing here, and so continuing to see that monthly slight uptick. Next slide, thank you. Revenue cycle KPIs. So just drawing your attention to what's probably already gotten your attention on the AR days and the cash collection. So a couple red boxes there. I think everyone's familiar with the Change Healthcare cyber attack. But the PFS team is working diligently to get things back in order as quickly as they can, and the expectation is by the end of June, we'll have much of that cash posted to the AR. So the cash is coming in the door. We're just not able to post it at this point in time without those details. As far as denials go, so continuing to trend in the right direction. So drawing your attention on the left-hand side, the quarterly government billing denials. We can see the trajectory there continuing to head in the right direction, and the net final denials, which is the result after those initial denials have been followed up on and resubmitted. Again, we can see that those are headed in the right direction and well below the target. As far as charitable and public program expenditures go, million for the year, so charity care at just under 132 million, bad debt at roughly 85 million. So where we'd expect to be in terms of total dollars and percent of revenues and percent of costs. Savings initiatives. So a couple, mostly green, but a couple of yellow items here. But the revenue recovery item, we expect to be back on track by the end of the year as the contract gets sorted out and we can get that project moving. And then last but certainly not least, health plan services. Just want to again reiterate the $2 million operating gain compared to the budget of $0. And then again, the county care membership, as you can see, the membership continues to grow and is well over budget. So, happy to answer any questions.
Any questions? All right. Thank you, Scott.
Yep. You're welcome.
With that, if anybody has any questions or comments, we have completed the Finance Committee agenda. Our next meeting will be, looking for when our next meeting will be. Friday, June 7th? All right, Friday, June 7th. That's a morning meeting, right? 9 o'clock. 10? Okay, all right. Driving mesquite actually. Unless there's anything else, we'll see you at the next board meeting, the Finance Committee on June 7th at 10 a.m. Thank you. The agenda's exhausted, so we're adjourned.
Thank you all. Thank you all.